Good evening, everybody. I'd like to welcome Dr. Cecelia Yu to my little chat session. And the reason I've invited Dr. Yu is that she is an upper cervical practitioner, and she's even more unique in that she practices upper cervical almost exclusively, and that is only adjust C1, not when. When is important.
When and if needed, and only C1. So yes.
Yes, C1 when, and I'm going to put my blue light blocking glasses on so I don't get toxified by blue light tonight. We can talk about that another time. Welcome, Cecelia.
Thank you for having me.
Okay, let's begin at the beginning, but not too far back. When did you realize that C1 was it?
So the funniest things about certain things in life, if it's the right thing for you, it finds you. So I wasn't actually looking to be an upper cervical doctor. I was just doing my thing in chiropractic. And when I got into chiropractic, it was one of those aha moments. And so after I started doing my internship at school, I still wasn't really big into upper cervical just yet. And it was one of those things that one thing led to another. One of my colleagues, her uncle is a third generation upper cervical chiropractor. And we weren't even talking that much in school at that time. But after we got out of school, we just connected. And she just told me to go intern at Dr. Dickles Jr.'s office in Chicago. And for whatever reason, it was just one of those things where I just felt so, it felt very mechanical in a way, because I was just so drawn to just doing the step. I wasn't even thinking it through. And I did my internship there. I went to his office and I saw an autistic kid. His name was Little Mikey. So sorry about that. His name was Little Mikey. And he actually spoke perfect sentences, all a matter of a week and a half, 2 weeks. And that was really profound for me, because it was one of those things where we all know we have this great innate within all of us. And with this little kid, he didn't learn all those words in a matter of a week and a half. He had that all within him. But having that power of the adjustment, it allowed him to actually manifest all that. So that was my most important situation / environment / story that really solidified my road on this upper cervical journey.
Dr. Dickholz was one of the most influential people in upper cervical care in our time, and I mean, the last 50 years. And to be exposed to him was quite a privilege, and he's now not with us.
Well, this is his son, Junior.
Okay, so that's...
So senior, senior, may he rest in peace. He's been super influential. He's still, I mean, the energy of him over in conferences, he's still well spoke about. So he still has this profound touch on all of us. But the one that I followed was Dr. Dickles Jr., Marshall.
Oh, that's wonderful that he's still alive, obviously. And my mentor, Dr. Roy Sweat, has passed away this year. So these two great originators are gone, but people are carrying on the work. And certainly you're one of them. And what college were you at the time?
I was at Parker University in Dallas.
Yeah, another great institution. And so now you are residing in Australia.
I am
in
Sydney.
I think you would be uniquely the only NUCCA practitioner here.
In the eastern side of this country, yes. So there's another doctor out in Perth.
Yes.
But I believe there's only the two of us, unfortunately.
Yes. I'm trying to think of his name. I know he's been here for years.
Now you're questioning me on that one too. It will come in the most random time.
That would be Dr. Kevin Carlson. Yes, he's been here for some years.
Yes.
And so you're now in Sydney, And so what are your experiences with telling people, for our young audience and old alike, what's it like telling people that you're not going to touch anything in their lower back?
I actually do a demonstration for them. So I allow them to tell me about their concerns, obviously, but it's a very quick and simple demonstration for them to actually see and actually feel how is all connected.
Okay.
Would you like me to run it through with you?
If you could.
Yeah. So first of all, we have to establish the short leg. So as an upper cervical chiropractor, we look at the short leg discrepancy. So when a patient is laying down on their back, the leg's kind of just dangling, and we see whether or not there's a short leg. The reason being with the short leg is when someone's, for our laymen out there, for those who may be interested, when someone's laying down, think of it as that sigh of relief for the body. Think of it as the weight of the head is off, so you're resting. As the person's resting, the nervous system should be at rest, which means the nerve should be at rest, which also means the muscles should also be very calm. And as the muscles are calm, leg length should be very even. But when the person's out of alignment, right, atlas is off, nervous system is off. So even though they're just resting, doing nothing, the nervous system is still misfiring, your nerves are still misfiring. So muscles are, I call it randomly pulling. So as the body randomly pulls that posture, it shows up with a discrepancy, an illusion of a short leg. So as that short leg is there, and as the person is still laying there, I go to the low back and I start feeling for whether it be tightness, tenderness, anything that's just different between the left and the right side. And the patient is the one telling me, oh yeah, there's a little bit more soreness, I can feel more tension, whatever is that they're able to tell me, we go with that. And then I actually have them turn their head over to the right. Just a simple motion over to the right, as their nervous system changes from the atlas, how does that change underneath my fingers? And then I have them turn their head over to the left. How does that change underneath my fingers again? And for the most part, they're able to tell a difference, whether it is for the better or for the worse. It really doesn't matter, because all we're looking for is you just turned your head over to the left and right, and you're already feeling a change into your nervous system as your nervous system actually changes from the atlas itself. So I don't need to touch the low back. I don't need to touch the pelvis or wherever else. We have to fix that atlas in order to fix the rest of the spine. So that's the part where once they have that distinguishing demonstration, they're able to see too, is from the atlas down that we need to make sure the atlas is exactly where it should be. And that's coming from the next part, which is a scan, which is the analysis, everything's mathematical. So we're only really chasing after the numbers.
And do you do that before you begin any care, any treatment?
Yes. 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 Yes.
And,
so even though there's also some people too where they don't even come in with low back pain, it's like, well, this is how it affects the whole body. So we're able to demonstrate that from just a low back.
Yeah. And you are also unique in that you're getting a lot of your line of drive diagnostics from cone beam CT. Is that correct?
I am. So cone beam CT, CBCT for short, is actually a technology that typically dentists use. So they're able to grab a 3-dimensional analysis, and typically dentists use it for airways, to look at TMJ. So we're able to utilize it by way of upper cervical in regards to taking a snapshot in a 2-dimensional way from that 3-dimensional analysis. And then from there, we can kind of also see the condyles, we can see anomalies. It's a really pretty cool tool. It's great to play with, and patients just love it.
It is.
And kids actually love it too, because it looks so scary on the inside.
So you are able to maneuver a 3D image that's quite brilliant and then break it down to a 2-dimensional slice for our purposes of analysis.
Yes, yes. And which makes things quite convenient too, because a lot of times upper cervical, misalignment causes TMJ issues, which then we can use the same scan and send that off to dentists, actually be able to see it from a different viewpoint and actually help the patient too in more ways than one. So in essence, we're able to share scans.
What will be on the mind of some people is, how did you access these services? Obviously, they're not bulk billed, so the patient has to be shown the value of paying for such a study.
Right.
Yeah. And
unfortunately, go ahead.
What would that be? Would that be $300 to $500 or less?
The scan itself, and I've seen it range between anywhere from like 150 to 250.
Okay, that's pretty good.
But yeah, so it's not, and I do believe that as there's more requests for the cone beams, that the prices will go down here in Australia.
Sure.
But my only concern though is still comparing to the technology and availability in the States, that there's still a little bit of a lag when it comes down to getting the top of the line machines out here in Australia.
Oh God, yeah. In fact, most medical procedures are lacking in this country of that sort of cutting edge. Even in medical treatment, so many people still travel to the US and other countries for stuff that a lot of neurologists here don't even recognize. So your journey has been one of, so how long have you been in practice?
I've been in practice for over 13 years. However, I've been out here in Sydney for 3.5 years.
Okay, yes. And I had the privilege of meeting you when you first came out, and I've been very watching your progress, and I'm so happy to have you here, and our community needs so many more people like you providing that sort of upper cervical care that is pretty rare. Well, it's rare around the world. What else drives you? Do you have anything else to add to anyone about the passion for your practice, and any comments that you have burning inside you?
Well, this is an embarrassing comment, actually, and I just learned this maybe 2 or 3 weeks ago. So, in the States, cervical we actually have 2 cervicals, right? So there's the upper cervical area, which is within the spine, and then there's the female organ, cervical.
Yes.
And I didn't know this until literally 2 weeks ago, after having been in Australia for over 3 years. There's cervical, and then the female organ, cervical. So no one corrected me for 3 years as to, you should really pronounce this upper cervical.
Well, I believe that's an Australian thing. Don't be so embarrassed. I still say
it is an Australian
cervical
thing.
A lot of the Australian colleges say cervical, but I'm US trained as well. And I will say one thing to alleviate your embarrassment is that from day to day, if people are confusing the vaginal cervical with what you're describing, you're probably not getting the message across. So personally, I've never found
a good elimination process.
To me, it reminded me a bit of skeletal. Some of the Aussies say skeletal, and Americans don't say skeletal. They say skeletal, cervical. So upper cervical, neck, spine. Well, I guess it's upper cervical, spine, and then there's the uterine cervix, cervical area. But don't feel so bad about that.
I figured it was just one of those great stories to tell.
Well, they're both very pertinent, significant areas worthy of specialization. So what else is on your mind? Do you have any ideas about practicing in Australia that might shock us or impress us or whatever? Do you have any comparisons or frustrations maybe?
Wow. Well, I do have
negative. You can be positive.
It's just something that I've noticed, right, in the years that I've been here. And it's always been a question as to, one, why are there not more upper cervical chiropractors out here?
Yes.
2, that kind of links to what exactly are the obstacles right? As someone who's had a practice in the States, as someone who's, moved way across the other side of the world on my own accord, really, not knowing kind of I guess really not knowing what I'm getting myself into, right? So in reflection, I do have to say, I think the whole country is they're very health conscious, which is amazing. But I do believe that as a society, Australians are very dependent on physios. And I feel that there is a lack of partly exploration and partly trust in the body and partly education in anatomy. Right. So I don't know if you've been practicing for over 20 years, I believe.
25, yeah.
Over 25 years. So, and having that education too in the States, so you talk to your colleagues in the States and whatnot. Do you concur with me in regards to where everything's very physio driven? And there's nothing against physio, it's great. There's a time and place. And that's where I feel like that order of things has been a little bit off.
Yeah, I would agree.
Let's see if this physio will work first. Let's see if this part works first. But we have to really get to the root cause first. And that's getting that spinal alignment in before we start rehabbing.
There are things that a physio does that I would honor them for and never do. I mean, I don't want to care for someone who's has to learn how to walk again or mend a bone or something. But I'll take it one step further. I'm astounded that the same attitude carries to neurologists and neurosurgeons, where I have referred them people whom I think have instability, craniocervical instability. Let's say there's a small population with you and I who won't hold an adjustment because there's such a traumatic injury to the ligaments and tendons, or they have Ehlers-Danlos syndrome or something like that. And the neurologist just says, no, it's all in your head. Go home, $300, please. I'm thinking, where does that come from? Did you study anatomy like me? Did you look at the same human body as I did? And I guess that may or may not be related to what you're saying, but people just think that there's no scope for anything else. Like the physio, most people, physios, I find that, that when they don't know what to do, they just give exercises. And I always say exercises doesn't fix anything. It prevents everything, but it doesn't fix anything. So yes, I mean, there's this reliance on physios, but to me, I have other theories about that around the centralization of domination of healthcare paradigms, and the physios have quite comfortably sat underneath the medical model, whereas we don't. What do you say to that?
I do think we're definitely a very different profession, even just as chiros in general. I think comparing to what I've been used to in the States, that there's more understanding of what a chiro does in the States compared to here. So therefore, I do feel when you try to get away from even just a general umbrella of a chiro, and now we're more niche into the upper cervical world, it does take a lot more education. It does take a lot more time. Is it because
there's a sort of a bottom-up physio strengthen muscles attitude that they haven't discovered our kind of neurological basis, our brain to body function? Is there a reverse sort of thinking, or
I actually think it may be a matter of numbers. There's just more friends and colleagues who may have been touched by a chiro before in the States, versus here, the general population, like the percentage of number of people who actually have gone through to a chiro, who have gone and actually see an upper cervical chiropractor, they're a lot less. So they're just not as well spoken about. I
The
feel
only
like it's more
thing,
of a numbers thing.
well, the only thing I could say to that is that I studied the history of the Australian Physiotherapy Association, looking at where they came from. Their inaugural meeting was made up of massage therapists and chiropractors, possibly some osteopaths. So most physios don't even know where they came in. The use of physiological therapeutics is also dated back to National College, Palmer College, even predating physiotherapy profession. They don't really know where they came from. But because it became like an all-encompassing club where they kind of used a lot of stuff, they just gained numbers. And maybe that's what you're saying. When you gain numbers, then you gain political influence. But chiropractors became kind of tight-knit, spine only, with hand only. We then limited ourselves, rightly so. Maybe that's the thing. And the more numbers you have, the more political clout you have. And so they're pretty much everywhere.
Yeah, yeah.
But the origin of physiotherapy is quite interesting in that, it wasn't that well established a profession in its own right. Whereas chiropractic tended to be specific and well defined from day one. But in this country, also,
something new today. Thank you for sharing
you've got that English influence, which were the bone setters and the osteopaths. Maybe Australia was more on that line. I don't know. But going back to what you do, I'm really excited that we might be able to join in a symposium soon of all the upper cervical techniques in this country. But there's only a handful of us, and I look forward to getting together with that, and maybe we'll have some interviews with some more upper cervical people soon. Is there anything else in closing that you would like to say and add?
Well, I've generated a motto from the very get-go of my career, and it is to change one atlas at a time. That's all you can do. It's just to fix that one atlas, move that one atlas, change that one life, and that's just the best that we can do. Do the best that we can, and that's the best that we can do.
I really appreciate that, because that's how I've built my practice over the years, one person at a time, one atlas at a time. If you like, it's a very biblical or a philosophical thing. One good deed at a time, perhaps, and taking care of your local community, so that you have a relationship with those people, and then it builds from that. And what a better way to build a practice.
One atlas at a time.
Thank you, Cecelia Yu. I hope we see each other real soon.
Thank you, Doc.